This is a demonstration of a typical treatment protocol for the upper extremity, especially focused on rotator cuff issues. Feel free to modify it as you see fit in your own practice based on the rest of your experience and education. We're starting with just a little bit of lubrication. I use coconut oil in my practice, trying to keep our hands warm. So we're going to be doing compressive effleurage and petrissage, some broad cross fiber work, some stripping. This looks different than the way we perform it on the lower extremity because the upper extremity is smaller and a little more challenging to do all these strokes on. So we'll start with general effleurage stroke and then add a little bit more pressure. I'm stabilizing and actually pulling a little traction on the arm so that we don't jam the shoulder during this stroke. And then we can move into little one-handed petrissage work. 2 hands. And this transitions nicely just into broad cross fiber work. Notice that I'm really trying to move my hand and thumb all together. Even though it may look like I'm doing this, I'm really trying to do this motion. And broad cross fiber in both directions, across the biceps, the deltoids, triceps, up around the shoulder, into the pecs a little bit. And because we're focusing on rotator cuff, we're going to really focus on the muscles of the upper arm, a little stripping of the biceps, stripping of the deltoids, maybe repositioning the arm and do a little flexibility work. This is a nice way to get to the inside of the arm for broad cross fiber. And then we would position the athlete in whatever we need to get access to the tendon to which we want to apply deep transverse friction. In this position, we could work on the tendon of the long head of the biceps or the tendon of the subscapularis. For working on infraspinatus and teres minor or supraspinatus, prone position is actually more convenient for the practitioner. That's a general warm-up to get ready to do deep transverse friction work on issues in the rotator cuff. Once we've done the warm-up work for the shoulder girdle and upper arm, we can begin to apply the deep transverse friction work. So we have the arm positioned so that the bicipital groove faces directly to the ceiling. We're going to place our flat thumb across the bicipital groove, feeling for the most tender spot reported by the client. Then maintain pressure and then rotate the arm back and forth to draw the bicipital tendon under the pressure to provide the deep transverse friction work. We have found this application to be more comfortable for the client if the arm is moving and the thumb is stationary as opposed to the stationary arm and the moving thumb. We maintain this pressure equal in both directions for about a minute, and that's the treatment position for the biceps tendon as it passes through the bicipital groove. For accessing the subscapularis tendon, it attaches just medially to the bicipital groove and just lateral to the coracoid process. Because the tendons of pec and coracobrachialis lay over the subscapularis tendon, we either need to gently, slowly sink down through those tissues till we can palpate the humerus, or we can come in underneath those. In this case, I'm going to sink through, turn my thumb pad sideways so that the pressure is against the head of the humerus, just medial to the bicipital groove, and friction is in a nose to toes direction, superior inferior direction, because the tendon fibers attach in this direction coming from the subscapularis. Once you find that most tender spot, apply pressure, maintain the pressure in both directions of the stroke, and slowly and carefully apply deep transverse friction for up to a minute the first session. And that's how you would do deep transverse friction for subscapularis and the biceps tendon. Once you've warmed up the tissues with effleurage, petrissage, stripping, etc., we can position the client to access the tendon of infraspinatus. She's on her elbows with a little bit of adduction and a little bit of lateral rotation. We're going to follow the muscle belly of the infraspinatus out till we can get to the acromion here. And this position brings the infraspinatus tendon out from under the acromion. We are palpating right at the inferior posterior angle right here. So this would be the infraspinatus tendon. It runs in this direction, so the friction would be in a semi-vertical direction. We use a braced finger supporting the shoulder so that the arm doesn't move. And this would be the friction work. We have found the most tender spot. And just as a reminder, the infraspinatus and the teres minor tendons blend in this location. The teres minor tendon is just a little bit inferior to this. It is rarely problematic. And we would do this for about a minute the first session, equal pressure in both directions, at a comfort level that the client can tolerate, and we would expect the discomfort to dissipate after about 60 seconds. So that's positioning for friction on the infraspinatus tendon.
If you liked this video and you want to see more, make sure to subscribe below and don't forget to hit the notification button.